Hello students, welcome to the class. In the previous class we have discussed about the sexually transmitted infections, reasons for sexual transmitted infections or causes, preventive measures and the treatment which is available for reducing the intensity of the sexual transmitted infections, pain, etc. In this class we are going to discuss about the disease called malaria. One of the common and very serious disease which is existing in our world. Malaria is a serious and at times even life-threatening tropical disease that is transmitted through the bite of an infected mosquito. The malaria is transmitted by the infected mosquito. It is usually prevalent in tropical countries such as Saharan Africa, Southeast Asia, Latin America and the Middle East, which have a warmer climate hot enough for the parasites to thrive. Malaria in India is a common vector-borne disease. India is also have the infection called malaria, which is very common in tropical countries like Sahara, Latin America, Middle East, Southeast Asia, etc. Then what causes for malaria? Female Anopheles mosquitoes spread the malaria parasites and this mosquito bites mostly in the night time between dusk and dawn. When a mosquito bites a person already infected with malaria, it sucks up the person's blood which is laden with the disease caused parasites. When the same mosquito bites another person, it injects the parasites into that person. When the Anopheles mosquito bites a person who is already infected with malaria to suck the blood, while sucking the blood they carry the parasites of malaria, and when the same mosquito will bite another person who is healthy, but while sucking the blood the mosquito will inject the parasites to the healthy person, causes the malaria. Malaria is very common in tropical horrid zone of the globe. Malaria can also be transmitted through blood transfusion, organ transplantation, shared use of needles, syringes that are contaminated with infected blood from a mother to her unborn before or during the childbirth. These are the common means of transfusion of malaria disease to one person to another person. Which are the symptoms of malaria? Malaria infection is usually characterized by recurrent attacks exhibiting the following symptoms: moderate to severe shaking, chills are very rigorous, high grade of fever which comes and goes periodically, which comes and goes. Sometimes fever is very low and absence of fever is also there, and sometimes very high fever also there. Perfusion, sweating. Then generally the patient presents with a combination of the following symptoms depending upon the severity of infection and types of parasite infested: headache, diarrhea, vomiting and nausea, extreme tiredness or fatigue. Severe body aches are common with the person affected with the malaria. Yellowish tinge of skin or jaundice. If the liver gets involved or attacked by the malaria, the person will easily become transmitted to the jaundice. Yellowish skin may be causes to the jaundice or predator. Malaria is waiting to attack the person, those who are already having less stamina or health conditions. If the jaundice involved, then the malaria will be threatens to the life. Anemia, bloody stools, kidney failure and seizure are also common in malaria. When the malaria is not curable or very rigorous, then it spread to the kidney failure, anemia may happen, jaundice may occur to the person who is affected by the malaria. Then confusion begins, there is no attention, it's not able to, the person who is attacked with malaria or infected with malaria is very confusion in state, coma, in extreme cases. It is not treated. Malaria may become life threatening by disrupting the blood supply to vital organs. Malaria may disrupt the blood supply to the vital organs. By distracting the blood supply, it may be life threatening by disrupting the blood supply. What is the preventive measures of malaria? Malaria can be avoided by using the ABCD approach to prevent. What is the A? Stands for awareness of risk. We have to know about the malaria and what are the symptoms of malaria, how it is spread, how it is transmissible for one person to another person. We have to know, aware. We have to aware about the risk. Then bite prevention of the mosquito. Check for breeding areas. Then we have to usually check the breeding areas of Anopheles mosquitoes from our from either and other premises of our area where we are residing. Then diagnosis, early diagnosis may cause best prevention for the malaria. Then what is the treatment which is available for malaria? Diagnosis through the blood test, specific anti-malarial treatment of severe malaria or artesunate, quinine, artemether, ether is the available medicines for treating the malaria disease. This is the main thing, or when it is neglected, it becomes life threatening. It's disrupting the blood circulation of the body and create jaundice. Kidney failure also may occur. Because of this, it's regarded as a life threatening disease. We have to aware about the causes. We have to prevent the diseases with proper preventive measures. The treatment also is available, but early diagnosis is the best way to get the treatment properly and prevent the disease from life threatening situation. Thank you for the listening. Thank you.